Hello all and welcome. We're going to wait just about one more minute before we get started. In the interim, you could please answer the welcome poll that's currently up on the screen. And if you have any lingering questions that weren't answered at the last roundtable or since the last roundtable, please feel free to put those in the chat. And our program coordinator, Amelia, who's on today, will happily triage those. So I'll give everybody just 30 more seconds and then we'll dive in. Okay, perfect. In the interest of respecting everybody's time, I'm going to get started. And so we will, Amelia, if you could end the poll, and we'll go from there. Perfect. So welcome to the Atlas Provider Roundtable for November 2021. We're very excited to have you here. There we go. If you missed something from our last roundtable, as a reminder, the recordings of all of our roundtables are available on YouTube. So you can get an overview of the Atlas survey and what that process will look like over the coming months. And we will also include the link when we send out the slide deck, so you don't have to write anything down right now. And I'll also note that if you're unsure where to begin with the Atlas survey, we did record an in-depth walkthrough of the survey that goes through each question that you'll encounter. That is also up on YouTube. And so that can be an easy way if you have specific questions, you can go there to check out how we suggest walking or really completing those questions. And Amelia's placing these links in the chat. So again, you don't have to write it down. It will be right there. And just as a reminder of who is speaking on today's webinar, I'm Carolyn Davidson. I am the Vice President of State Engagement for Atlas. My colleague Shannon Biello is on as well and will be speaking shortly, as well as Leah Kaufman, who's a Director of State Engagement for Atlas, as well, and Anga Butara, another Director of State Engagement. And they are probably very familiar faces at this point. Just a quick rundown of the agenda. We'll start by talking about some kind of ways that you can get assistance from us and some updates. We'll also remind you of the alternative option for large facilities. We just had a last minute change in Audible, if you will. We won't be talking about the patient experience survey during this webinar. We will save it for the next time. And then a brief note on the continuous quality improvement learning series and a Q&A. And I will note that our webinars during the data collection period may be somewhat similar. So some of our content will be repeated. For instance, we'll continuously remind you of how to walk through that alternative option for large facilities, as well as our continuous quality improvement learning series. But we will place our updates at the beginning of the webinar. So for instance, if you just want to come for the updates and then hop off, you are welcome to do so. But if you'd like to stick around, hear a refresher of the information, ask us any questions audibly, please feel free to do it. And with that, just a reminder that the survey opened on Friday, October 29th. So on that date, you or a member of your team should have received a link to the Atlas survey for your facility. You can start and stop the survey as you want, and your responses will save. And if you did not receive a link, please use the Atlas help desk to request this link. And I'm glad that we're seeing questions in the chat. As a reminder, if you have any questions, please send them to everyone or directly to Amelia Wilburn, our program coordinator. And so just a quick reminder about the treatment facility survey. It gathers information on clinical processes. It's completed at the physical facility level, and it also assesses barriers to delivering high quality care, as well as ways that your facilities may have been impacted by COVID. Just a quick note that completing the TFS, completing the Atlas survey as we call it, so it's less insider baseball. It has many benefits. It ensures that your facility information is accurately displayed. It allows you to demonstrate your commitment to quality and transparency. When you complete the survey, once we analyze the data, you're given information to benchmark yourself against your peers and understand areas for improvement. You can increase the visibility of your facility and really capture the ways that your facility is unique. So for instance, you may offer some languages that are not offered at other facilities in your area. And with that, I'm going to turn it over to Shannon to talk about a few of the questions that we've been seeing since the survey opened on October 29th.
Thank you, Carolyn, and welcome everyone. So happy you're here. If you do have the chance, as Carolyn mentioned, I encourage you to watch the walkthrough of the survey where we go through all the different types of questions and content that appears in the survey. You'll have to spend a couple minutes with me on that, but we're hoping that it's useful for you as you are completing the survey on your own. We wanted to give a brief update. As you know, this survey launched on October 29th, so exciting. And we have since been very actively managing the Atlas Help Desk and the various other opportunities we have for people to connect with us to support in survey submission. So you'll see at the top, we say that, at this point we received 48 help desk requests. That's from the around the start of data collection to about last week. We're probably more in the 50s now, which is great. We want people to be actively, submitting tickets, getting any kind of assistance or guidance they need from us. We are here throughout this whole process to support you in the survey submission process. And we just wanted to briefly outline the majority types of requests we're receiving so that we can talk through how to handle some of these requests. Again, if yours doesn't fall within these parameters, totally fine. Just submit a help desk request that describes, the issue or challenge you're experiencing, and we're happy to provide that one-on-one support. As Carolyn will note in this presentation as well, it's truly our staff answering these questions. So we're really receiving those tickets and then personally responding to you to make sure that you're able to complete your survey. So not surprisingly, one of the, or probably the most requests we've received are for survey links. That's a very simple, and contact updates and facility address updates. These are very, very simple things for us to handle, and we can usually handle them very quickly. You are more than welcome to submit a help desk request for this. There's an option to either request your survey link or provide a contact update, or both. You can submit multiple requests within a single ticket. That way you're not spending a lot of time submitting information to us. Or you can email Atlas. That's been done as well. And both options give you a channel for receiving that survey link and doing a contact or facility update. I'm going to quickly put in the chat to everyone the email address that is where you'll receive your survey links from. So on a regular cadence, we'll be sending our providers reminders about the survey. That email that I just put in the chat is where those reminders come from. That's the email address. If you're not finding that the emails are getting to your inbox, feel free to search by that email address. It might be falling in your other box. It might be going to spam. So we always like to share that with you just in case you haven't seen it yet, or there's some challenges with you receiving those emails. Likewise, if you're not listed as a contact for your facility or should be, just submit a help desk request or email us at Atlas, and we're more than happy to update that promptly so that we can make sure you get those links. Another thing we're seeing is we've adjusted the way that we submit facility hours in the survey. So there's been a number of requests related to how you can submit those facility hours. Those are type in open text responses, and it's in the format of hour colon, in the minutes. So, and then you always need to put the AM and PM at the end of it. If you don't type it in correctly, fret not. There will be an error message that appears for you and tells you exactly how to format it. That section is very formatted, so we anticipated that there might be some need for guidance there, so the guidance appears. But if you continue to have issues with submitting those times, those hours of operation for your facility, just reach out to us and we're more than happy to help you submit that. Another thing that we've been receiving requests about, or requests for guidance about, is when data submitted with the May survey will be reflected on the website. That's a great question. We are deep into the validation process. It's been a really good thing where we go through and complete a multi-step process to validate the survey responses we received. We're expecting that, based upon where we are in the validation process, that the survey data from the May data collection period will be up on the website in December. Super exciting. If you have any questions about that, feel free to reach out to us. If you're in a newer state, that doesn't apply because you are part of the October data collection period. And another thing we wanted to flag too is you may receive a survey that's tagged or connected to an administrative location for your organization. Totally fine if you're receiving a survey or request for a survey and you say, that's our headquarters, that's our admin building. Please feel free to reach out to us and we're happy to adjust that in our database, and to also make sure that we reflect all your treatment sites. And finally, and I think this is something I won't dive into here because we'll be talking about it a little bit more, but certainly receiving requests for additional information about how to use the streamlined submission process. As a quick reminder, we offer this to our larger organizations that oversee multiple treatment sites. I know Leah's going to dive into this a bit more, so I'm not going to linger on it here, but receiving requests for additional information about this data transfer process. So we're going to spend a few slides going over it just to make sure that you're completely clear on what's needed for that. Next slide. I love this slide because we are here for you. And I'll just quickly go through and then my time with you is done. But we have multiple sets of resources for you if you're having trouble with the survey or if you just want to have a quick question answered. We recommend, of course, going to the FAQ page. That gives you basic high-level information about the survey itself and the types of questions that are available. When is the survey due? What do I do for questions that allow you to select multiple options? All that information is in the FAQ. If you take a look at the FAQ and you still have a site-specific question or you have something that's lingering in your mind that you really want to ask us about, you have multiple options here. You can submit a ticket to the help desk. You can put multiple requests within your help desk ticket, and my team will respond to you within 48 hours. So really trying to get quick turnovers because we know you're taking time to complete the survey and we want to help you as quickly as possible. Another option, if you prefer, is Atlas office hours. So you can complete the form linked here to request a meeting with our team, and one of our either myself or one of my colleagues will join a 30-minute meeting with you where we can talk through what your questions are, making sure that if you prefer to talk through it, you feel like it's easier to have a phone call about, or you have multiple questions, you have that option for office hours as well. And then finally, we always emphasize this, bullets, underlines, you can always email us at atlas@shatterproof.org. We are quick to respond. We're actively triaging those requests to make sure they go to the right person on the team, and we'll be able to answer your questions or send you in the right direction through those emails as well. So multiple options. Please reach out to us because we're here to assist you through this process, and we appreciate the time that you're taking to complete the survey. So thank you all so much.
All right, I think that's my cue. So as Shannon mentioned, or actually Shannon, you didn't mention this. So we, as you may be aware, because I know we've mentioned it in emails in the past, we have a reference copy of the survey available if you're interested in receiving that.
No, it looks like Leah's internet may have cut out briefly. Leah, when you are, oh. Leah, are you back with us?
Can you hear me, Carolyn?
Yes, yes.
Great, I apologize. I'm not sure what you heard, so I'll just repeat that we have a reference copy of the survey available if you would like to use that. It helps streamline the process of doing the survey. You typically have to go to 2 or 3 people at a facility to get the answers to the survey. So for example, your billing person and your clinical program director are the 2 most common people to do this. So just let us know if you would like us to send that. You can use it as a worksheet. This is not where you submit your responses. We do not take anything in paper or via email, but you can fill it out and then go on the use your survey link to enter the information you gathered. Next slide. And you can just click to the whole slideshow. There we go. So for large organizations, as Shannon mentioned, if you have at least 2 physical locations, we have a much easier process. The folks who did this in the first round last year indicated this was a pain point for them if you have multiple sites where you're entering the same information. So luckily now, if you have multiple facilities, we will be able to transfer your information from one, I guess, parent survey or like one main survey to the other surveys if your policies and procedures are the same at each of those sites. So you do have until mid-January to elect this option if you haven't done so. Let's go to the next slide. So basically what you would do is, I like to use the example if you have like 2 facilities that are outpatient, but let's just say 3 facilities that are outpatient and 3 that are residential, and their policies and procedures are probably the same. You could do one for the outpatient and then one for residential, and then we would transfer those to their other respective sites. So you would then only have a small portion of questions that you'd have to do individually. And the reason we can't do 100% transfer are because things like ADA access or staffing at a given facility are going to be different from site to site. But definitely, please, if you have 2 sites or more, definitely do this. We didn't have a lot of people take us up on that last year, so we're trying to get that information out so everyone's aware of that option. And I realized actually, if you were on the roundtable the last couple of months, a lot of the information from here on out is going to be repetitive. So feel free to drop off unless you have questions, because we will have the Q&A at the end. And so final note on the survey alternative survey option is that you have to still have a CEO or similar executive level leadership member attest to each survey individually. Obviously, the benefit is that this is going to save you a lot of admin time. And if you're not already aware, when you do this in the second year, like our first 6 states are now doing, your information will be pre-filled. So that will save you time in the future. So I appreciate your patience and all the time you're putting into doing this. Oh, and we have 26 facilities who've taken advantage of this option so far. I did not know that. All right. So streamline submission, I think we already said this, but you can go ahead and email us atlas@shatterproof.org. Also feel free to email your state directors. I know if there are folks on the phone with Florida, I owe several of you follow-ups from last week, but we're working on getting those out to make sure we can minimize the effort and time you have to put into this. So feel free to reach out to me, to Anka, to Carolyn, or to our general inbox. And I believe with that, I'll turn it over to my colleague, Anga Bhatar.
Great, thanks, Leah, and good afternoon, everyone. Thanks again for being here today. So as we talk about reasons to participate in our survey and have your facilities on Atlas, we have our password protected portals. And so what you can see on the top screenshot here is just a sample of what your portal will look like. We just redesigned this process in these visuals, so we're really excited to bring these to you. And if you have questions on them, of course, let your state director know. We'll be happy to walk you through the data there. We also have state resource cards that we've worked with our state partners to send out to various organizations and community organizations as well. And we've gotten really good feedback. I know Leah's done some really good work there, specifically in Louisiana as well. And we also have our continuous quality improvement learning series. And our next session of that is actually on Wednesday, November 17th. So if you have not registered for that, please do so. But the idea here is to bring technical assistance resources to our provider community. We're really focused on building and sustaining a strong quality improvement infrastructure. A lot of what we talk about are related to our national principles of care and our quality measures that are in Atlas as well. And we always make sure that the speakers are presenting on resources, whether it's content or other items that they might have. We always want to make sure that those are available to our provider community as well. And then the last item here is discussion on how to best implement practices to improve the quality of care. And we do this via various case studies, provider panels as well, really getting real life experience based on different various quality improvement projects. And all this information is available on our site, which you can see at the bottom of the slide, treatmentatlas.org/CQI. Next slide, please. So as we have here today, our provider roundtables are really meant to, of course, answer the questions that you all might have, but we also want to make sure that we're providing updates as it relates to Atlas more broadly, and also make sure that we're sharing updates to the platform, the data collection process, our patient experience surveys, and our portals as well. So you may not have heard of all of that today, but there's a couple of roundtables coming up next month on December 15th and on January 5th as well. So if you haven't already, please register for those so we can make sure that the invites make it on your calendars. Great. At this time, I would like to open it for Q&A.
If nobody's ready to talk yet, I'm happy to read the few questions that we've received in the chat. So this first question comes from Nicole, and Nicole asks, for the evidence-based modalities / therapies in the TFS, what are accepted forms of education or training?
Great question. So that can be either during, say, a school, like during medical school, during school for specific providers, or it can be during any sort of continuing education opportunities.
Thank you, Carolyn. And then we have a question from Ford Baker asking, providers are reporting issues with not getting the survey to accurate email addresses. So maybe we could talk a little about how we address that.
Sure, great point. And I realize I can stop sharing my screen as we're at the question part. So I will note that the bulk, just for some context, the bulk of the email addresses that we use for Atlas and for Atlas emails, in case you're like, where'd you get this email address? We work directly with our state partners to get a list of the facilities and their corresponding contact information. So for instance, in Pennsylvania, we worked with DDAP. In New Jersey, we worked with DHS. In North Carolina, we use the DHHS list. So if you're wondering, like, how'd you get these facilities? In almost all cases, it is directly through the state licensing agency. And similarly, that's where we get the contact information. And for many of our states, it is a requirement that a facility be licensed and or certified, depending on how your state works, in order to be included. If there are any providers who did not receive a link, certainly we welcome you to contact us at Atlas@Shatterproof or use the help desk. Similarly, as Shannon noted, if you feel like the contact information we have on file is not correct, we welcome you to contact the help desk or Atlas@Shatterproof to have that information corrected. And if any of your colleagues said, I didn't get the survey, they also can email us. As we said, there are no wrong doors. So just a little bit of context of where those emails came from, and we would welcome your corrections.
Awesome. Thank you, Carolyn. And then we have a question from Robin asking, who are the plan partners in Pennsylvania and where did that provider list come from? They're worried because that list may be incomplete.
Good. I was going to turn it to you to talk about Pennsylvania, if that's helpful. I was like trying to telepathically look at you through the screen.
No, I was trying to get the mute button, couldn't get there fast enough. So in terms of the list, I think as Carolyn mentioned, we received that list from our DDAP partners. So we work closely with them to make sure that, based on our scope in a given state, the state or the list is sort of encompassed all of that. Now, having said that, there are going to be probably updates that need to be made. And so, as we mentioned, the various avenues to do that. Again, there is no wrong way to contact us, whether it's the help desk, the Atlas inbox. I can be a resource to help there as well to make sure that at the end of the day, we have an accurate list in our database. And then we'll be sharing that feedback with, in this case, DDAP as well. And there was a question, I think, on the plan partners. So when you say plan partners, I'm assuming you're referring to payers and the different plans that we might be partnering with. I want to make sure I'm understanding the question correctly.
That's correct. What health plans you're partnering with in the state of Pennsylvania and also New Jersey. We know about Horizon, but I see other plans listed on your presentation from previous months.
Sure. So specific to Pennsylvania, so the way it'll work is the current payers that are sort of present in the state, that doesn't change really from an Atlas perspective. We haven't developed any formal partnerships, and Carolyn, keep me honest here, with specific plans in Pennsylvania. I will say we've had conversations, with a few of the plans in terms of helping us promote Atlas at the appropriate time, help promote the survey to their network of providers. But that's kind of where we are with the current work in Pennsylvania.
Yeah, I'll say Angad said it completely right. And I'll just add that, kind of as Angad noted, we work with a lot of the national plans who may have coverage across several states. So for instance, when we say that we partner with them, they may supply a very small amount of funding and don't have a governance role in the project. And then also, as Angad mentioned, they also help to promote Atlas. But for instance, the plans aren't deciding which providers are included in Atlas. They're not deciding what goes on the survey. They're not deciding what gets published on the website.
That was all the questions that I captured in the chat. So if anybody has questions that they would like to ask verbally now or post them in the chat, I'm also happy to read them for you. So if you don't want to talk, I'm happy to do that as well.
While you're thinking through your questions, we have an exit poll that you can fill out. And if you'd like, you can fill out the poll and hop off, or you can stay on. We will be hanging around for the next several minutes, and so certainly invite you to stay on. And Amelia will post again just all those links in the chat. So the link to the help desk, the FAQ, the walkthrough, and the office hours request form. And Amelia, please keep me honest if I forgot something, as well as the Atlas email. Again, there are no wrong doors. We are really here to help you, and so want you to reach out if you have any questions. Oh, perfect. And the roundtable links. Thank you, Amelia. Yes, exactly. And so as a reminder, as Leah stated, the beginning of the roundtable will be reserved for updates, and then the rest will be focused on questions and kind of reminders about the different options.
Carolyn, I was just going to clarify really quickly as well for people with the contact process too. You can add as many contacts as we understand multiple people take this survey, but you have multiple eyes on it. So when you send us contacts, we always want a primary contact designated, but we can add secondary contacts or tertiary contacts, or just, we call them affiliated contacts, to the survey as well, so that if someone just wants to keep tabs on it, they can be included in the emails. We have no problem sending you emails. We just don't want to bother you. So feel free. We can add as many contacts to your facility as makes sense. We know that multiple people deal with different components of your work. So the contact isn't just limited to that primary one. And again, very simple for us to update this information, and we're happy to do so.
Thanks for that reminder, Shannon. So please feel free to think of questions. We'll stay on, we'll sit in silence for maybe the next 2 minutes, but we certainly invite you to jump in.
Yeah, from the looks of the poll, it seems like some people that participated may still have questions. The chat or even the Atlas inbox, I just posted the link to that, or I just posted that address as well. So feel free to ask questions now or later. We truly are here for you.
I'll give it one more minute and just share the results of the poll. We're seeing that most people are feeling good and have all the information, and some people are still a bit unclear. Please feel free to reach out either now or via email. And then I think we'll stop in just a minute. Thanks, Beth. Okay, it looks like our numbers are starting to drop, so I'm going to end the webinar. As a reminder, we'll be sending out the slides and recording in follow-up, as well as links to the next webinars and all of those exciting links that we posted in the chat. So we look forward to talking to you soon. And thanks for your time today. Bye all.